Welcome to my world. The topic for today is typhoid correct lab diagnosis. This is a very topical issue, and that's why I have tried to put it in the front burner. Does the laboratory diagnosis? My emphasis is on lab diagnosis so that you also can probably assist in getting the best result for yourself rather than wasting your money continually going for the same test over and over again. The objective: to correct all misconceptions on the correct laboratory diagnosis of typhoid fever. The introduction. The picture on the right is the Salmonella organism itself. So it is the electron micrograph of a Salmonella. Salmonella are gram-negative bacilli, rod-shaped non-sporing bacilli with petritricial flagella. Salmonella typhoid has virulent capsule. It's about 2 to 4 micron in length. Yes, let's talk about how it enters the body. Virtually all the pathogens of the alimentary canal enter through the mouth aboard food, fluid, or fingers, even vomits. Salmonella has predilection for gallbladder, where it resides inside the gallstone it formed by itself. Yes, this diagram is very useful to demonstrate how Salmonella organism moves. The injection of Salmonella makes it move towards the area it has predilection for. First of all, we want to say it moves to and find its way to the small intestine, where it moves into the mesenteric lymph node, and finally the bacteremia it causes in the blood. The macrophages would usually engulf it, and it multiply inside the macrophages. From there, it is moved to all the organs, both the liver, spleen, and bone marrow. It could also then come out as septicemia, where you now feel the fever, the pains, the kidney problems, or other organs are infected. So Salmonella can infect any organ. Then it has the predilection to move to live more like permanently in the gallbladder, where it forms gallstones. That gallstones usually cause this cholecystitis, a serious pain, and the stomach discomfort, and it is also the place where it hides, and it comes out regularly in the stool of carriers. It also could cause inflammation, ulceration, peritonitis, diarrhea, so many problems that it could cause. So all these problems that we are mentioning and areas that it travels to are what constitute the samples you are collecting. But we must understand that all these movements are time bound. So the timing of this kind of samples you collect is very important. So we move into the next diagram that tells us what are the right sample to collect. The different necrosis and destructions you see is already shown in the diagram that are attached to this diagram. This graph you're seeing demonstrates or illustrates more or less the best time to collect the samples. You will see written on the x-axis is the week after onset of the fever. So the fever, once you have that fever, it is the best time to collect blood. You can see blood in the graph as very high. So when the temperature is very high, that's the best time to collect the blood samples. So that blood sample will surely yield Salmonella organism that is causing the infection. You have various species of some serotypes of Salmonella causing the different problems. I mean that typhoid fever. Then you can look at the second week when it is more appropriate to collect feces, the stool samples, and probably from the after the second week going towards the third week, you can collect urine samples. The same thing applies. The blood samples that you are collecting are what you want to use for your serological test. So anytime you could collect the blood sample, it's also the appropriate, because once the fever has started, it means the immune system has started showing itself. And what you would expect in the beginning is the IgM, later IgG, and all these are antibodies. And the serological test usually tests for the antibody produced. The laboratory diagnosis is a very important aspect of correct diagnosis, because typhoid fever presents with fever. That's high temperature, just like majority of all these organisms that invade the blood. Any foreign body that enters the blood body defense mechanism will come out with fever. So it is always a problem doing the correct diagnosis. But with typhoid fever, the blood culture usually become positive early in the disease during the first bacteremic phase, that is probably the first 7 days. The moment you start feeling that fever, that high temperature, that is when it is the best time to collect the blood sample at the bedside, just like it's shown. The urine samples could also be collected at the second week, and the stool culture from the second week up to. Like I said, a rising titer for serological test, the moment that fever starts, that blood culture that could be collected, also you can collect blood samples for serological test, the one we call wider test. The bone marrow is the gold standard when you are talking of, but it is a very invasive technique, because you know from the diagram I showed that salmonella can penetrate into all the other organs, because it multiplies inside the macrophages. It is only when the cell-mediated immune response during the second bacteremia phase that you can now see the macrophages killing it. In the beginning, they multiply inside the macrophages and they are carried almost everywhere in the blood, and that's why they can infect any organ. It's a pathogen per se. Finally, let us talk about wider tests. This test has been so controversial because many people want to use just this screening test. When you use it as a screening test is when you use the slide, the upper one, alone to confirm whether there is a reaction or not. But when there is a reaction, you want to confirm the rising titer. That's when you now look at the bottom photo, which shows tubes. That tubes is used for the aggregation test to show a rising titer. You can see the rising titer from 120, 140, 180, 160, 320, 640. These are the expected tubes that once there is reaction inside, that aggregation confirms that the titer of the antibody reacting against the antigen is very high. With the upper test, you can even have the experience of prosome phenomenon where there is no reaction at all. You want to believe with slide test that there is no reaction, whereas one should, even where there is no reaction, try the tube test. The tube test will always show reaction, because with prosome phenomenon on slide test, the aggregation can be covered, and because there is no dilution, and you want to believe that the patient has no antibody against the antigen you use. So it is a serious case that one wants to do very diligently, and therefore please just watch more of my videos.